Management of left ventricular failure. Management of left ventricular failure. In management, there will be included features of left ventricular failure, features, then investigation, and finally treatment of left ventricular failure. Features includes symptoms and signs. Symptoms and signs. Now, first of all, symptoms of left ventricular failure includes sudden onset of dyspnea, and number 2, respiratory distress. Sudden onset of dyspnea and respiratory distress. The signs of left ventricular failure are in general examination and in precordial examination. It will be described under 2 headings: on general examination and on precordium examination. On general examination, we will get pulsus alternus, then cold periphery, pulsus alternus, cold periphery. Appearance will be agitate appearance. BP low in case of cardiogenic shock. That means BP is very low in case of cardiogenic shock. Number 5, jugular venous pressure JVP is increased. These are the findings in general examination. On precordium examination, the findings will be on precordium examination. Findings will be number 1, gallop rhythm. Number 2, new systolic murmur, mitral regurgitation and ventricular septal defect. New systolic murmur. Mitral regurgitation and ventricular septal defect. And finally, bilateral basal capitation. Bilateral basal capitation in case of pulmonary edema. So features include symptoms and signs. Symptoms are dyspnea, and then sudden onset of dyspnea and respiratory distress. Signs include general examination and precordium examination. On general examination, the findings will be pulsus alternus, cold periphery, agitate appearance, and low BP in case of cardiogenic shock, and raised jugular venous pressure or elevated jugular venous pressure. On precordium examination, we will get gallop rhythm, new systolic murmur in mitral regurgitation, ventricular septal defect, bilateral basal capitation in case of pulmonary edema. This is the photo. Of This is the photo which indicates sudden onset of dyspnea, that means breathlessness. Then number two symptom was respiratory distress. What is respiratory distress? Respiratory distress is a condition in which a person has a difficulty breathing, usually due to an obstruction or injury to the respiratory system. Due to an obstruction in the pathway or injury to the respiratory system. Signs, symptoms. Done. Signs includes number one, pulsus alternus. There is variation in pulse, pulse amplitude occurring with alternate beats due to changing systolic pressure. It occurs due to changing systolic pressure. Best appreciated applying light pressure on the peripheral arterial pulse and can be confirmed by measuring blood pressure. Applying light pressure on the peripheral arterial pulse, radial pulse, and can be confirmed by measuring blood pressure. Then cool periphery appearance as I said, BP low in case of cardiogenic shock, jugulovenous pressure elevated. On precordium examination we will get gallop rhythm. Gallop rhythm means presence of S3 and S4 heart sound. Presence of S3 and S4 heart sound is known as gallop rhythm. New systolic murmur includes mitral regurgitation and ventricular septal defect. On precordium examination we also get basal crepitations, basal bilateral basal crepitations we will get in case of precordium examination. Bilateral basal crepitation in pulmonary edema. Finally, next stages we will study about investigation. These are the signs, symptoms or features of left ventricular failure. Investigations investigation includes chest X-ray, ECG. Number 1, chest X-ray. Number 2, ECG. Number 3, echocardiography. Number 4, cardiac enzymes. Now finally some blood tests. Blood tests include CBC, renal test such as serum urea and serum creatinine. Then serum electrolyte, thyroid function test, and BNP. These are the investigations done in case of left ventricular failure. Now chest X-ray. What are the findings in case of chest X-ray? There will be cephalization of vessels. There will be cephalization of vessels in case of chest X-ray, and we will get pleural effusion in X-ray findings, and also increased cardiothoracic ratio. That means we will get cardiomegaly from X-ray findings. Cardiomegaly. Number 2, ECG. ECG findings. These are the ECG findings in left ventricular failure. Left ventricular hypertrophy. In case of left ventricular hypertrophy, there is alteration of QRS complex. This QRS complex is small, but it is large. Cardiac enzymes. Some cardiac enzymes also helps in the diagnosis of acute myocardial infarctions. So these are troponin, CKMB, LDAs, myoglobin. Troponin, CKMB, LDAs, and myoglobin. Blood tests. Blood tests include CBC, renal tests such as serum urea, serum creatinine, serum electrolyte, thyroid function test, and BNP. First of all, CBC. What are the findings that we will get from CBC? Low levels of RBC or anemia can worsen the heart failure. Again, if we get high level count of WBC, which indicate infection or reaction to medication, and elevated hemoglobin levels are associated with increased risk of coronary heart disease. These are the findings we'll get from CBC. Then renal or serum urea level. Serum urea and blood urea nitrogen or BAN levels are important predictors of short and long-term survival in patients with heart failure. BAN level, blood urea nitrogen level, can increase mortality risk by 20% for every 10 milligram per DL increase. Elevated blood urea nitrogen levels are likely due to a combination of factors including hemodynamic alterations, neurohumoral alteration, and renal hypoperfusion. That means elevated blood urea nitrogen indicates hemodynamic alteration, neurohumoral alteration, and renal hypoperfusion. Next, serum creatinine. What does serum creatinine indicate in case of heart failure? Patients with elevated serum creatinine levels on admission to the hospital for decompensated heart failure have a longer hospital stay, higher stay of rehospitalization, and or 6-month mortality. Serum creatinine level can be elevated in heart failure patients because the heart is unable to pump blood properly, which can also lead to congestion of the heart with blood, increased pressure in main vein connected to the kidney, congestion of blood in the kidney, reduced supply of the oxygen to the kidney, in the kidney. Then serum electrolyte level. Serum electrolyte levels also important in case of heart failure. Electrolyte imbalance. Patients with heart failure are often deficient in serum sodium. Which can lead to agitation, irritation, and prolonged hospital stay. Agitation. It is the sign of heart failure. Low serum chlorides, low serum chloride ion associated with the use of loop diuretics. Loop diuretics such as furosemide, torsemide, etc., which are commonly used to treat heart failure. Magnesium, hypomagnesemia, that means magnesium ion decreases, can lead to hypercoagulability and worsen heart failure. Hypercoagulability, that means increased coagulation of blood. Next, thyroid function test. Thyroid function test also directly related to the heart failure. And finally, we will study about BNP. Full form of BNP is B-type natriuretic peptide. BNP test can help diagnose heart failure. It confirms heart failure, especially if you have shortness of breath, a common symptoms of the heart failure. A normal BNP level less than 100 picogram per milli usually means heart failure is not the cause of the syndrome. BNP helps in monitoring, predicting in case of heart failure. A BNP test can help predict the chances that your heart condition will get worse. Higher than normal BNP levels indicate that your heart is not pumping enough blood, or that your kidneys are not functioning properly. Low BNP levels can occur even if you have heart failure, especially if you are obese. That means in case of obese person, the BNP levels will be low yet if you have heart failure. These are all the investigations in case of heart failure. Chest X-ray, ECG, echo, cardiac enzymes. Blood tests include CBC, serum urea and serum creatinine, serum electrolyte, thyroid function test, BNP. Now we will study about the treatment of heart failure. Treatment includes emergency management of acute left ventricular failure. Emergency management, it includes keep the patient at popped up position. Number 2, high flow oxygen level will be very high flow oxygen. Then ensure CPAP means continuous positive airway pressure. Nitrate, then loop diuretics includes furosemide, torsemide, etc. And keep the patient at rest. Then monitor some vital signs such as BP, oxygen saturation, and cardiac rhythm. If the patient is hypotensive, then inotropic agent such as dobutamine will be given. Inotropic agent will be given in case of hypotensive patient. After the patient is stabilized, treat the underlying cause of heart failure. Treat the causes. Morphine / opioid to prevent respiratory distress or air hunger. Morphine and opioid is given morphine or opioid. Morphine and opioid is given to prevent respiratory distress. Finally, prevent cardiac remodeling. Prevent cardiac remodeling by using cardiac remodeling. Prevent cardiac remodeling by using two types of drugs. One is angiotensin converting enzyme inhibitor and angiotensin receptor blocker. These are the two drugs which helps in prevent cardiac remodeling. These are the treatment modalities in case of heart failure. Emergency treatment. First of all, we will keep the patient at a soft position. Then we will give a high flow of oxygen. We have to ensure continuous positive airway pressure. Then give nitrate. Use loop diuretics such as furosemide, torsemide. Keep the patient at bed and monitor vitals such as BP, oxygen saturation level, and cardiac rhythm. Inotropic agent will be given in case of hypotensive patient, and treat the cause if the patient is stable. After becoming stable, we will treat underlying the causes. And in case of respiratory distress patient, we will give opioid and morphine. And cardiac remodeling is prevented by angiotensin converting enzyme inhibitor and angiotensin receptor blockers. If we summarize the topic from first to last, management of the left ventricular failure includes features, investigation and treatment of the left ventricular. Features include symptoms and signs. Symptoms, first of all, sudden onset of dyspnea and respiratory distress. Signs includes on general examination and on precordium examination. On general examination, the findings will be pulses alternance, whole periphery, agitation, low BP and raised jugular venous pressure. On precordium examination, we will get gallop rhythm, new systolic murmur in case of mitral regurgitation, ventricular septal defect, and bilateral basal crepitations. Investigations includes chest X-ray. Number 2, ECG, echo, cardiac enzymes. Blood tests include CBC, serum urea, serum creatinine, serum electrolyte, thyroid function test, and BNP. Treatments will be according to situation. In case of emergency situations, patient will be kept at popped up position, then give high flow of oxygen, ensure continuous positive airway pressure, give nitrate, and then use loop diuretics such as furosemide. Keep the patient at rest, monitor vitals such as BP, blood pressure, oxygen saturation, cardiac rhythm, and give inotropic agent such as dobutamine in case of hypotensive patient. Then treat the causes. The patient is stable. Opioid and morphine is given to prevent respiratory distress or air hunger. Prevent cardiac remodeling by giving angiotensin converting enzyme inhibitor and angiotensin receptor blocker, ACE inhibitor and ARB.